Hi, Dr. Raj Chopra. Thank you so much for joining us today.
Thank you, Seamus. Thanks for having me.
Let me just explain about yourself and about your background. With over 2 decades of experience as a board certified radiologist, you're currently working with a large practice in the West Coast of America. Multiskeletal radiology is your specialism, but you have a number of other advisory roles working with AI, the FDA regulations, billing and coding. I was lucky enough to see one of your pieces from the RSNA where you presented on a clinician's view on cybersecurity, emphasizing the need for transparent communication and reliable vendor collaboration. You've also co-authored a number of other pieces, really exploring how AI can alleviate the radiologist burdens and managing that large workload and making sure the patient is at front and center of everything you do. So over to you, if you wouldn't mind just telling us a little bit about your site and your hospital and how that might resonate for us back in the UK.
Thanks, Seamus. I appreciate the introduction. So a little bit more about my hospital system. My hospital system is very large. It's the second largest not-for-profit hospital system in the country, and we care for a large number of patients across a large geographic area, just like NHS is trying to do with their patient population. We have a lot of problems because of the size and the scope of what we are trying to deal with, and there's a lot of problems that NHS addresses in their 10-year plan that resonate really well and are very parallel to the problems that we're trying to address here in the States. In a time where, there's just not enough clinicians, if it's radiologists or non-radiologists, we're trying to find technology that kind of braces us for the amount of work that's coming at us. And NHS, I applaud them for addressing this head on. As I went through the 10-year plan, I saw so many similar ideas and thoughts that we are trying to address here in the States. And I'm excited to be able to talk about the parallels between the two.
So let's talk a little bit about the challenges that you face at your practices and some of the changes you've made to try and address those requirements.
So similar to NHS, we have a physician shortage, right? The turnaround times that are expected of us to get the work out so good patient care can occur haven't changed, but the amount of work has changed. So we're trying to do everything we can to increase efficiencies, not only within the system, but with the doctors who are caring for those patients. Those efficiencies used to be that we tried to, flog the doctor to do more. Well, there's just no more, slack in the system where we could do more. So we're looking at technology and seeing how it can help alleviate some of those stresses. So the long-term challenges of all systems, all big and small, is how do we come up with the workforce that can do the work that's coming at us? How do we make sure that systems don't fail so that the work piles even more? So redundancy in the system is key. How do we make sure that there isn't burnout from our physicians and make sure that they're focused on the task at hand, which is to care for our patients? And how do we make it so that you can move images or information throughout the system so that you're not repeating things, or that the best possible physician is looking at the problem and not just anybody looking at the problem? So, the ability to move information, NHS focuses on how to get different types of data over to new people. Similarly, in radiology and in teleradiology, that's what we're looking at. How do we get the right people to the scan so the images are read in a timely fashion? The problems are related to all we talk about are problems these days, Seamus. It seems like it's the only thing that any of us focus on, regardless of hospital system or country. But we all need to sit down and take a deep breath and look at, of those problems, what can we solve? And that is something that we need to break down on a piece by piece, on a people scale, on a technology scale, on a patient scale. On all three of those factors, what can we do to make patient care be supported more than it is right now?
Thank you. Thank you. And presumably, when you decided that you had some challenges, you had to make that market appraisal, and you went through that process. You came out and we're lucky enough for you to choose the Merge VNA as part of your essential tools in your toolkit. Can you talk us a little bit about how you came about that market appraisal and why you decided that the Merge VNA was going to be the essential tool for increasing the productivity and efficiencies at your site?
Oh, that's a good question because we've looked at a lot of different vendors, and there are a lot of different vendors right now in the marketplace. And what we did was really, just like I just said, we looked at what our problems are and saw which vendor can fix those problems the most efficiently. And for me, when I was part of that decision-making process, who can make sure that we don't fail? And Merge was the one that really stood out to us. And I'll give you some examples. Our previous vendor had a real problem with downtime. So if you can imagine, there's cases coming into our packs at a rate that we can't even count. If you look at our lists, they're so long, we don't even see the bottom of the list. So if you have any type of downtime, you have to, you're piling onto that list, right? So then you have to dig out of a hole that you're already in, a large hole, you're going into a deeper hole. So downtimes are a huge problem. On patient care suffers, the clinician doesn't get the information they need, the radiologist that's reading it is burning out, and you have to pay a tremendous amount of money to dig out of that hole. So Merge and the VNA gave us redundancy. And that redundancy is key so that the system is always working. I'll give you an example. About a year ago, our previous vendor went down and we were down for hours. Maybe I think it was close to almost a full day. And in any given day, thousands of exams in our system, as you can imagine, for something our size, are piling up. Well, we recently had a small downtime, not really related to Merge, but it was a downtime. And Merge was able to move over to a new server and use VNA to kind of move images over to a virtual server that made it so that we were back up and running within 7 or 8 minutes. So I would much rather have 7 or 8 minutes where I can go get a cup of coffee and instead of days where I'm losing a lot of radiology time. And so that was one of the big things is the redundancy that the VNA gives. Also, I'm really into technology, as you can imagine. The VNA allows for new technology to be deployed at a rapid rate. So as you figure out what AI tools are needed in your system, if it's a nodule detector or if it's a ADOC, which looks at, what images are important to read at a quicker pace because there's something emergent to look at. All those things, as you decide which ones are good and which ones are for you and which ones you don't want, the VNA allows for you to come in and out of different technologies at a rapid pace without having to rebuild the infrastructure. And that's huge as you're figuring out this whole AI space, like we all are. None of us know which AI tool is going to be the best tool. Things are changing so rapidly. And if you don't have that VNA infrastructure to come in and out of different tools and have to rebuild each time a new AI tool comes onto the market, it just kills productivity. It costs way more, and you can't use what's out there in a rapid fashion. And right now we need rapid. We need everything that makes us more efficient and quicker. If that means radiologists or the IT infrastructure, and VNA does that for you. And then I think the other thing is we have a big teleradiology presence, and we're bringing up new hospital systems that we're covering and all the time. And the VNA allows for movement of images at a much rapid pace and consistent pace than not having the VNA. And so for me, that was really important, very much like what NHS is trying to do, right? You want stability, which is what Merge provided. You want the use of new technology, which is what Merge allowed for in a rapid and sustainable way. And you want to be able to move information between clinicians and hospital systems. So one, you're not duplicating things. And two, you're being as efficient as possible for the patient. The VNA allows for that in a seamless kind of way. So that's why we picked it.
Obviously, it's early days, and the system is still very much bedding in. But you've had it for a while now, and you've had time to experience its benefits. Could you talk a little bit about whether you feel and the feedback from the team about whether you collectively made the right decision, and maybe some early indications about why you feel that was justified?
No, it's a good question. Anytime you spend this type of money or you make this type of decision, it's really easy to be apprehensive. You're making decisions that, of course, there's a monetary part of it, and that's a big piece in a time where budgets are very tight. And then the other thing is the people who are using the tool, you don't want to offend or, make them upset because they're already at their brink of, working so hard to get the work done for you and for your patients. So you don't want to disrupt their lives. So the key is the efficiency piece, Seamus. I mean, that's what we wanted. And our previous vendor, to be honest with you, even to bring up the images took a lot longer. So we've noticed an incremental improvement just in the ability to see the images quicker. And you wouldn't think that would have a massive effect, but when you're looking at the number of images and the number of doctors that are working at any given time, the cumulative effect is in multiple, at what we call FTEs here in the state, full-time equivalents, how many doctors are actually working on a given day. So we've noticed incremental improvements. Now, we're kind of new onto the system, as you mentioned. And so I don't want to give out numbers yet because we are actually improving week to week. And if I give you a number today of 5 to 6%, I think by next week it'll be 10 to 15%. So I don't want to give a number right now and say, oh, it's only 6 or 7%, because I believe it's going to get better as we get better with the system. So that the implementation piece the team was wonderful that helped us implement, and they've been there and available to us to fix the problems as they come. So that's key. You need a partner in this. And that partnership is so important as you make big decisions like this, because it's not always going to be perfect, right? Things are going to have bumps in the road. What your expectations are may not always be what you expected, what came out of. But if you have a partner on the other side that's understanding what you're saying and adapting to your needs as they see the deployment occur, it's huge. It's very, very important. And Merge has done that for us. And so, yeah, there's more parts that we're going to test as we get with the technology more. But we're super excited because even with the early returns at this point, we've seen a gain. And that, whenever you change technologies, getting used to it, you expect a drop off, right? You're used to a certain type of PACS, your certain type of how your data is managed, how the images come up. And so there's this, period of time where you're adjusting to the new. Well, I can pleasantly say our adjustment to new was really pretty quick. And we went from, most, some of the data we have shows that when you change PACS, you have a decrease in efficiency of almost 30%. We did not. We did not see that here. We were back to reading our normal number of exams within 2 days. And that's pretty impressive when you're talking about a massive shift like we had. Not only that means that the radiologist adapted, but the technologists in the background adapted and our IT personnel adapted all in a very quick fashion. And it was because Merge had a very good plan and they had a lot of contingencies in place. So when there were bumps in the road, we were able to address them quickly. So far, Seamus, the returns are really good.
Oh, that's great news. It's really, and thank you so much, Raj, for your time. It's such a, in summary, it's such a simple tool to get the right VNA for your site. And just that simple IT tool, once implemented and once really embedded, from what you're saying, can really help to increase those efficiencies and really bringing all the close down on those silos, bringing all of those teams together. And most importantly, making sure that patient is up front and center and they get the best quality care that you and your partners and your staff can offer. So really, thank you so much for your time, Raj. Really interesting.
No, thanks for having me. I appreciate it, James. Thank you.
Thank you.